So part of my frustration was that I had a lot of patients with seizures and they were taking a lot of medications, and the side effects of the medications were becoming horrific. They were so wiped out that they couldn't even go to school. So you start looking for alternatives. What else is out there that can help me with this? And that's when I really started to discover the whole cannabis piece and how that was very effective. And some of the patients I had weren't in states where cannabis was legal. So that really sort of took that option out for a lot of the patients. So I started looking as what is there available in supplemental form that isn't controlled that way, that can give me the benefit for these patients and allow them to start to decrease the medication so they can start to function again and have a life. Because a lot of them, it's not really living. You're medicated, you're zoned out, you can't even live your life. So that's when CBD really, industrial strength hemp oil, which is a supplement with CBD, became a prime target of let me learn about this so I can understand how this works and will it help these patients. And what I've seen is it's helping a lot of patients get off a lot of medications and sort of get their life back. I've got a couple of kids that are recovered from autism that started to have seizures, and they were doing very well, and then the seizures took them down a bad road. And now they're coming back because we're able to use the supplement CBD. And I think that's one of the most important pieces, is that this is a supplement. And when you look for cannabidiol, you look at the patent, it tells what it can do. And in the patent, it says for prophylaxis or prevention and treatment. So this is sort of an unbelievable supplement, because not only does it help prevent things from happening, but you can use it to treat conditions. And the first thing that I really started using it for was with patients with seizures. And then I had some children with CP who had spasticity and issues there. We started using it with them. We started seeing improvement there. I've got several cancer patients now that we're treating with the CBD, and their numbers are getting better, they're feeling better. So it's really applicable to so many things. And when you look at the patent, it's for anything that causes oxidative stress. So you look at brain inflammation, you look at Alzheimer's, you look at Huntington's chorea, you look at MS. I mean, you just go down the list. Any dementias, it helps prevent damage from getting worse, and it helps to repair the cells. So when you look at that, you go, okay, so what else is oxidative stress? What else can cause those kinds of problems? So you look at glaucoma, you look at arthritis, you look at gut inflammation, so Crohn's, ulcerative colitis, inflammatory bowel disease. I mean, the list goes on and on and on, because one of the big pieces that CBD does is help modulate your immune system and decrease inflammation wherever it is, because it's acting on the immune cells themselves. And they have the receptors, the T cells, the B cells, the macrophages, the monocytes have receptors, so that the CBD literally talks to those cells and calms them down to decrease inflammation. So you can use it with autoimmune disease, you can use it with anything. And Lyme's, I've had some patients that had Lyme's that were having a lot of pain and issues and had immune shifts, and they're starting to shift back to normal and feeling better and better. So I don't think there is a limit to the applications. But to me, one of the most important pieces is this is preventative. So for healthy people, for anybody, taking this as a supplement, I think provides you with tremendous relief that I can start to prevent the things that may run in my family so I don't have to have it. And to me, that is really important. So to me, that's sort of what medicine is about, prevention. And it's not really so much about treating the acute conditions. You have those things that you need to treat. But the way I look at it is, if I can educate people and get parents healthy before they have babies, then they have healthy babies, and we work to keep the babies healthy, then I think that's where the real piece of medicine and the art of medicine is. And it's educating and allowing people to make good choices and giving them the information and having that right to choose. And I think that's really important.
Who do you recommend it to? How do you recommend it, kind of like
Okay.
For the general public, or for children, for
Okay.
any information around who
Okay.
can get benefit from this, who could be benefiting from taking
Okay.
it? And we're rolling?
Mm-hmm.
I think it's can be beneficial for anyone because it helps prevent things from happening. So in some of the studies, they looked at creating strokes. And what they found was they can create a stroke and give CBD up to 6 hours after and decrease the damage that the stroke did and decrease the amount of cells that are affected and stop the ischemic process. And that also works for cardiac muscle because it's protecting the muscles, it protects the cells, it protects your mitochondria. So it literally can stop ischemia from progressing and destroying more and more cells. So I think, this is the whole piece is you can use it to treat, but you can use it to prevent. So if you have a family history with heart disease, it decreases plaque, it decreases its buildup, it keeps the blood vessels from becoming leaky and the monocytes from coming out, becoming foam cells, producing plaque, and then the plaque gets eroded and ruptures. So that's what sort of causes cardiovascular issues. So you can prevent all of that with CBD. So who would you recommend it for? I would recommend it for everybody. I think as a supplement, it's going to help anybody who has any family history of anything because it protects from inflammation. Well, most every disease that we know and treat has to do with inflammation. So any condition that has that. So you look at multiple sclerosis, and part of what it does is protect the oligodendrocytes in your brain, which make myelin. And it can stimulate the production of more myelin, and it protects the precursors, the stem cells that make the oligodendrocytes. So when you think of the power that this has, I think it can prevent a lot of things from happening. So that's why I think it's really a supplement that should be used preventatively to keep people healthy.
Now, is the one you had a specific case of a person? Like with? Oh, that was that one. Okay, great. That's awesome. You didn't tell us that last time.
Didn't ask that question.
Okay, cool.
Is there time to, because of this conference and everything, there's going to be a big announcement on Monday, that there is a correlation between the endocannabinoid system, CBD, and autism. So if you really want to go there, you can go there, and it'll be in your documentary.
Okay.
Isn't that huge?
Yeah, totally.
In fact, I would love it if you would. Their last talk went viral around the world in like no time at all.
Okay. All right, so I was asked to speak here at Autism One. And looking at the endocannabinoid system, which is our system that helps regulate every function in the body, it's interactive and it responds in an instant with the production of endocannabinoids. So what the research is pointing to now is that there is a link between an imbalance in the endocannabinoid system and autism. And that part of that link is through the gut and the dysbiosis. In other words, when you don't have enough good flora, the bad flora start to produce toxins. And some of those toxins may be cross-reacting with the endocannabinoid system, sending wrong signals. So it starts to create havoc. and it can lead to inflammation. It can lead to all of these issues that are a big piece of what's going on with autism, because they have brain inflammation, they have gut inflammation, they have these processing issues, they have limbic system issues with emotion and learning and memory. And when you start to look at what does the endocannabinoid system do, it helps to modulate all of that. So for kids with autism, I think the CBD as a supplement is a tremendous addition to what you can do. And it really starts to pinpoint, okay, they're having seizures, you can work with that. They have this whole issue with sensory processing. The endocannabinoid system affects that. So you're going through and looking at what are the possibilities that I can help with CBD. And I think that is where the big information in the future is going to come. And to me, it's very important that we do have this supplement, and it's available in all 50 states. And that now we can start to do some more research here using the supplement to see what is it doing, what is it helping, and specifically get more information, because we just haven't been able to do that up to this date.
So is this issue of autism, is it, I don't know if you would comment on that, but closer to home for you than most people who...
Well, I think a lot of physicians who work with autistic kids is because they have a child or stepchild or someone that's very close to them who's been affected. So then it becomes very personal. And it becomes, how can I help them? And what are the tricks that I have that may help them? So then you really have to approach functional medicine. You can't just do traditional medicine because the medications don't work. They don't recover the kids. And the idea is, how can we help that happen? So you really have to start looking at a different approach and asking some different questions. So if we have inflammation going on, what is going on with them? And for a lot of these kids, they have immune shifts, and they get shifted a Th2 shift, and they start producing a lot of extra antibodies, which then adds to the inflammation. So when you think about CBD, what does it do? Well, it remodulates your immune system, and it calms it down. So then it's like, okay, this is something that can help me with the brain inflammation, with the gut inflammation, with wherever this inflammation is. Because whenever you have inflammation anywhere in the body, the interleukins, the cytokines, which are the messengers, which are the triggers to increase inflammation, travel through your bloodstream, and they go everywhere. And part of the issue with autism is the blood-brain barrier becomes leaky, and CBD reestablishes the blood-brain barrier. So it now makes it less penetrable to those problematic pieces like heavy metals that are coming in that we're all exposed to every day, and prevents them from being so quick to get into the central nervous system. So it provides so many different answers on so many different levels. And I think as research goes forward, and there's ongoing research now into the gut flora, and are they making false transmitters that are affecting the endocannabinoid system and turning it off? And when you think about like even the issues with obesity, a lot of that has to do with your endocannabinoid system, and a lot of the obesity really is the reaction from inflammation. And part of that can be that you getting the CB1 receptor stimulated in some way that's increasing those activities, because as you look at the cannabinoid receptors, CB1 receptors increase inflammation. They increase the development of fat tissues. So when you look at that, you're going, wait a minute, if this does that, if I can modulate that, then I can start to help people who have obesity and start to help them lose weight and decrease the inflammation, because a lot of that is inflammation based. So it just provides another pathway into that to help. So I mean, I think that's where CBD is taking us, is into a new area, it's like a new shift, a new paradigm of we're learning about this new system, the endocannabinoid system that we were never taught about, didn't even know it existed. And now we're starting to get so much information, and I think it's going to be tied to most every significant disease there is, that it's going to be able to help that and help reduce that.
Awesome. So can you talk to us about what your just tell us about your traditional medical education and how you didn't learn about the endocannabinoid system?
Oh, okay.
Yeah.
All right. So, being traditionally trained, I went to a regular university and then a medical school for 4 years. Then I did a 3-year residency. And in that whole amount of time, really didn't learn a lot about nutrition. And endocannabinoid system wasn't even known. And the interesting piece is that to talk to physicians today, when you start to mention this, nobody knows what you're talking about. They have no idea. And this is information that's really been sort of withheld. And is it withheld, or is it that traditional medicine is so locked in with their blinders on because it's past the tradition, the information is passed from generation to generation. So it tends to shift slowly. So, you know, when I graduated from medical school, they said, you're 20 years behind. I mean, you know all this stuff, but you're 20 years behind. So it's like, all right, so how do I catch up on this 20 years? So it's like you think, well, my residency is going to help me catch up. Well, and it does to a certain extent. But then you really have to start looking beyond just the information that's in the medical books and the medical journals, and really start to look at what's going on in the world and what's going on with other countries. What are they discovering? What are they learning about? And then you really start to get some different answers than what you've been told. And you really start to learn, you know, there's some basic pieces to good health that we don't even consider to be good health. And you've really got to start with those foundational pieces and get those in place. And then you can start to prevent things from happening. And I think this is one of those pieces you add to the preventative side, and then you're going to see less and less issues down the line. And I think that's what it really can add. And for all of us, I think for physicians, we've been trained, we know what we've been taught, but we've only been taught so much. And there's a lot more to learn, so we have to keep going and keep learning and keep on that thirst for knowledge. And I think that's really what drives a lot of physicians, is they really want to know, they want to educate, they want to teach and share. But if you don't have the information, you can't share it, you can't teach it. So it's just getting the information out and starting to learn what are the pieces that are going on, how can I help? So first I was a corpsman from 69 to 73. And that really got me stimulated to want to do more medicine. So then when I got out of the Navy, I went back and went to University of Louisville for undergrad, and then University of Louisville Medical School. And then for pediatric training, I came to Chicago to Lutheran General Hospital and went through the traditional training there, board certified in pediatrics, and practiced traditional pediatrics for over 23 years. So then in the last 5 to 10 years of that, I really started to ask some other questions and really wasn't finding the answers I needed. When I first went into practice, I really had no autistic kids in my practice. And for the first 12 or 14 years, I had no autistic kids. And then I opened a second office, and within the first month, I had 45 kids with autism. And it was like, what is going on? There's something that isn't right, and why are we now seeing all of these kids? And in residency, when I went through there, autism, it was described differently than what we're seeing today. So it's a changing piece, I think. And I think it really has to make us question what we're doing. And it's like, what is it that's changed so much over my lifetime that we didn't have many of these kids and now we're having an explosion? I mean, it's like an epidemic. So you have to start looking at what are the pieces that we're doing that are creating this, what's going on in the environment, what are we doing? And I think there's a lot of answers there and a lot of pointing at this may be contributing. So you have to figure out what's contributing and what are the predisposing factors. And I think you can start to look at DNA now, which wasn't available quite a while ago, and you can start to see patterns that are predisposing kids to have issues. And I think we need to look at that and need to think and take these rational things that we now know and apply them and approach this in a whole different manner. You know, how can we do what it is we need to do and prevent things from happening instead of maybe contributing to being a trigger to cause things to happen? And I think that's where medicine really needs to start to look again, is how do we help and how do we prevent disease instead of being the treaters and perpetuators of acute situations. You know, when you look at the medical system the way it is, we're really good at treating acute problems. I mean, we're the best at that. But how do we prevent the long-term problems? How do we prevent the complications? And I think that's when you start looking now at the chronic illness that exists, that we really haven't addressed these issues in the right way. I mean, you can treat the symptoms of an acute problem, but if you don't figure out the underlying mechanism, it's going to come out in a different way. So it really gets down to focusing on what is causing the problem, looking for the cause, not just treating the symptom.
Just tell us about what you think is about, like, kind of a trend of more doctors starting to study and recommend CBD.
Okay. I think at this point there's been a sort of an awakening in a lot of the young medical students that there really is more going on than what they're learning in school. So they're more open to what it is that is going on. And I think they're starting to probe what are the other alternative pieces that I can put into my practice that may help to change and prevent things from happening. And I think the schools are becoming more aligned with that whole idea that we really need to look at how do we help keep people well. I mean, you look at some societies and they lived into old age without any chronic illness. So how did they do that? And how can we get to do that? You know, what are the pieces that we've learned? What are the things that our ancestors knew that were helpful? And I think you start looking at CBD and this whole history of cannabis and all of this, it's been used for thousands of years. So were they helping to prevent things? They didn't quite understand what they were doing. And I think, you know, that's an interesting piece, because you start thinking now, okay, this whole endocannabinoid system has been there forever, but we're just learning about it now. So as we learn, then we have to turn around and start to apply this. And I think this is where a lot of the young physicians are really going to start to step up and go, gee, could be very helpful. How do I do this? How do I learn about this? And I think as we do, and as this information about the endocannabinoid system gets out, what are the potentials that can be done, start to cut through the red tape. And there is big stigma when you start talking about, when you use the word marijuana. That word has its own connotation, and I think talking now more about the medical cannabis and now specifically the industrial hemp oil with high CBD, you can really start to pull away from that. So for a lot of people, they don't have that stigmatism attached to that word because they don't really understand where it came from. So now you can provide relief and you can bypass what we've been taught for years that, this is a horrible thing, but it does have a good side. So it's a conundrum. And I think the younger people are going to be more open to accept that and run with that ball.
It says, who is CBD for? Can anyone take it? Why people don't know about it?
All right, so why don't more people know about this? And I think it's been a matter of the media really focusing on trying to get medical cannabis passed and not really informing people that there is an option that is available that is not the medicinal cannabis, but it's the CBD, which is the medicinal active part, which does most of the benefits of the medical cannabis. So they don't know that this is available. They don't know that it's a supplement. They don't know that it's available in all 50 states. And to me, that's been part of what I'm trying to educate people about, is that this is something that is available that can help you now. You don't have to wait. And I think it's just getting that information out, but that isn't what the broad media is really trying to get out. That they have a different message. So in giving their message, they've left this one in the dust, trying to promote what it is they're trying to promote.
Is it also has it been known, it's been known for quite a while what CBD is, right?
Well, the research on CBD has mainly been done in Europe and Israel and some in South America, Venezuela and Brazil. So that information has been out there, but it's not something that was taught or readily available. The whole endocannabinoid system has been plotted out, it's drawn out, we understand the chemistry now, all of that's there, but it's not something that's been incorporated into the information that most physicians get at all. And I think, this, for the American physicians, this is going to be a whole new game. And I think it can really start to shift some way people think. And some of this has been known and been researched in the U.S., mainly using the synthetic forms of the cannabis, because you really can't do research in the U.S. with that. But the compounds that mimic that, a lot of places are starting to work with and doing the research. So it is there, it is starting to become available, but it isn't mainstream yet. And I think that's the trick now, is how do we get it mainstream? And that's really trying to educate physicians to start to ask those questions and start to do some research themselves. And that's really how you're going to get that to change.
Can you explain the difference between synthetic and all natural?
All right, so you look at sort of where we are, and the way pharmaceutical companies look at compounds is what is the active ingredient, and that's what I want to copy. So that's how we're going to do it. The thing is that Mother Nature makes it very different, and it's a group of compounds that work together. So when you look at a more natural way to go at something, you're going to get other benefits that aren't exactly the same as the synthetically derived. So it's like vitamin C. They've sort of purified that down, but it's really a complex. And I think that's what we're going to find over time, is that CBD is this one piece, and it's very powerful and very potent, and it's available today. But there's other cannabinoids that have medical application. So my goal for the future is to see that we have CBD plus some other cannabinoids that are going to give you a more powerful picture, because the combination of using what Mother Nature put together is going to be much more powerful than if we do one piece of it. And it was like in Europe, they know that the CB1 receptor helps to modulate weight. So they came up with a blocker for that and did some clinical trials with this, and then released it and using it on the market. And what happened was it blocked the CB1 receptors and people started to lose weight significantly, very quickly. The problem was 90% of them got depressed and they had a high suicide rate. So when you start playing with this and you're not having it balanced, then you can create some other issues. And that's sort of what I think they're sort of learning at this point, is that yes, this can help with this, but if I go that far, then it can start to have other consequences down the line that are complications like medication. So you cross that line again.
So when we have the CBD rich hemp oil, we're getting a blend of all of the cannabinoids, right?
Right. Yeah. I mean, the whole thing is this is a natural supplement that's derived from the oil of the plant. So it has all the plant pieces in it. So it is the more perfect supplement because it has all that together in it. It's not just one little piece that's doing one little thing. And that's when you start looking at the research on CBD, it affects not just cannabinoid receptors, it interacts with a lot of other receptors throughout the body doing different things. And that's how it interacts with your immune system. So it interacts with your nuclear material through the PPAR receptors. I mean, it starts to interact with a bunch of different receptors, creating this cascade of improvement through the systems. So it's not just one thing. And I think that's, as you start to look at the research for this, you start to become aware that this is not a simple thing. It's actually complex. It's simple in that it's CBD, it's cannabidiol, but it's more than that because it's really this compound that's taken from nature, from the plant, and it does have other things in it that are starting to work in balance. So I think that's a big piece of what's going on.
Can you compare CBD and THC for us?
So from a physiological standpoint, what is THC doing versus what is CBD doing? And I think once you start to understand the receptor system and how THC works with the CB1 receptors, then you get a little different picture of what THC is doing. So THC mainly works centrally in the brain, in the CB1 receptors, and that's the whole euphoric piece. But at the same time, it stimulates appetite and it helps to relieve pain. The limiting factor when you're using THC with CBD helps to block some of those euphoric pieces. So when it's a combination, you can get a bigger tolerance with THC. So in some of the cancer patients that have the bone pain and these types of pain, you get the central effect against the pain plus the peripheral effect against the pain from CBD. So it's two different processes, both affecting and reducing pain, but one works centrally, one works more peripherally. So it's affecting that, and for some people that's a tremendous combination that they need, especially with cancer patients or AIDS patients with these significant amounts of pain. See, the THC piece also affects appetite. So for a lot of the patients that it was approved for was really to help stimulate appetite. So cancer patients that were losing appetite, AIDS patients that were losing appetite and getting these wasting syndromes, they found that the THC not only reduced the pain, but it helped to increase their appetite. So that helped them recover because you need that good nutrition to help your cells get back to normal. So those two pieces work together. But the limiting factor they found in a lot of the studies was how much THC was in it and how your body reacted to it. Because THC at a low dose is anxiolytic, but as the dose increases, it creates anxiety. and it can make paranoia. So it's like that's sort of the little edge to it that you really have to be careful with. So the neat thing about CBD is you don't have that. It's at the doses, it's anxiolytic. It decreases that. It helps decrease the pain perception and decrease the pain. So you can treat abdominal pain with CBD. You don't have any of the issues because in the gut, THC decreases motility. So if you have enough of that, you can create constipation. So if somebody's already having an issue with constipation, you're going to make it worse. And with constipation, then you're reabsorbing all the toxins that you're trying to get rid of. So it makes your liver and kidneys have to work harder and harder to clear things. So the CBD doesn't do that. It helps to decrease the motility, it decreases the inflammation, but not to the extent that THC does it. So they each have their applications, I think, but the broad picture is as a supplement that will help prevent things and can treat things, I think the CBD wins hands down because it really has a broad range of applications without toxicity. And in some of the studies, they've used very large doses and saw no side effects and did it for months. So it's like you can have these doses and they're not going to affect you. The other thing is with THC, you get tolerance, so you need more and more to get the same effect. You don't get tolerance or dependence with CBD. So when you find the dose that works for you, that dose is going to continue to work for you. You don't have to keep raising it. So it has a whole different spectrum of applications when you look at it that way.
Can you explain to us how people use oil, effects on the body, endocannabinoid system, and how people use oil?
Well, I think the neat thing is that there's different applications and there's different sources available so you can find what will work for the individual. Everybody's different. Some people can take a squirt of the oil, put it under their tongue and hold it there, let it absorb, and that's a wonderful thing. But for a lot of kids, they won't do that. So now you've got to come up with new delivery systems and how do I get this in? So the neat thing is with the oils, they even work transdermally. I had a little guy that was having significant anxiety and we got him over that, but he couldn't continue to tolerate the squirts of the stuff in his mouth. That was a sensory issue that he was having that we were having trouble overcoming that. So what we did was we took that spray and we started applying it topically to his feet. And it worked. And it's like, okay, so we do one squirt on each foot and rub it in and just it gets absorbed and it goes in. So there's an unlimited way this can be used. So whatever the individual needs. So with the liquids, you can put those in a smoothie. You don't want to heat it, but you can put it in a smoothie. One mom talked about putting the size of a grain of rice inside a raisin and then putting that on toast so that her child would get it and eat the raisin and not even know they got it. So there's a lot of different ways. You can do capsules, you can do the liquids, you can apply it topically, you can use salves. I mean, there's a whole array of choices. And I think that's really a big plus because now you can match the individual with what they can tolerate and what will make sense to them to get in. And then you just have to start low and calculate the dose, gradually go up to where you get the results you're looking for, and then you know where you are. So with the CBD-rich hemp oil, there are multiple ways that you can introduce that and get it into the patient. And depending on what the patient likes, will they tolerate the oil in the mouth? Will they want a capsule? Will they want a chocolate bar that has CBD in it? So you come up with a bunch of different choices. So you're going to be able to match what you want to a product that's going to be able to help you and get the CBD in. All right, so the reason that I like the products that Meds PX is offering is the quality and consistency. And you know it's been tested. I know that the amount that it says that it's delivering, it is delivering, and that way it's a consistent, predictable form that I can feel confident about, that if I want this person to get 25 milligrams, we can work that out and get 25 milligrams, and it will be consistent across all the products. So to me, that's what's important when you start considering, how do I dose this and who is good for this, is knowing that this is a quality product, it's consistent, it's clean, it has no toxins, and it's very effective.
Is it safe? Is it going to make my kid high? Are there side effects?
Okay.
Those concerns.
All right. So when you look at who can use this, how can you use it, do you have to worry about it? And I think that's where really the safety of the CBD is very important, because they've given very large doses over an extended period of time and seen no side effects. The other piece to really remember and think about with this is you do not have these receptors in the brainstem, which controls cardiovascular function and respiratory function. So there is no complications where you're going to see issues with heart or respiration. So you don't have any of those things to be concerned about. So as far as, is it safe? Is it okay? Is it going to create a problem? The answer is no. There have been no problems that have been uncovered in all the research that's been done, hundreds of thousands of research articles who are looking at, is this viable alternative? Are there issues that we really have to be concerned about with long-term effects, with overdose, with any of that? And the answer in all the research that's out there is no. This is not a problem. It's not something you have to worry about. Well, to me, as you look at the research and you go, okay, it doesn't create any of these problems, so that tells me this is a safe way to use. And the neat thing is, this is a supplement. And as a supplement, you're going to be taking low doses, and there is no issue. I mean, it's the safest thing you can probably take, and probably one of the most beneficial supplements that you could ever give yourself. If you had to make a choice of one supplement that I would take that's going to provide me anti-inflammatory, protect my brain, protect my mitochondria, increase my energy, increase my stamina, this is going to be what you're going to want to take, because it's very safe and simple, and it works.
I know you mentioned the epilepsy stories. Is there anything else that you'd care to mention that you've encountered in your practice? You
Well,
mentioned
I think,
epilepsy.
yeah, looking at the impact that I've seen with it and the progress that people have made have been big with seizures, and I have a lot of insomnia patients that don't have insomnia anymore that have had it for years and years. I have patients that had really aggressive cancers that are starting to get under control. So to me, it's a new open door to really give more help. So it provides for people, this is a way I can feel better, I can take charge of my health, and it helps to re-empower the person that they are the one who's healing themselves, because we don't really do that. As you look at the research and you look at what can happen and what can be accomplished, so who is it that really should be taking this? And my recommendation is everybody, because you can use it to prevent issues from happening. And this is taking the power for your own health back to your own hands. And to me, as a physician, you need to have the power to be healthy. And it's your choice, and it's always your choice. So you can choose to do things you know that are helpful, or you can choose not to do them. And the idea is, if you're having an issue and it's something that CBD can help with, even if you're questioning could it help, my recommendation would be to try it. You've got nothing to lose except relieve the symptoms and the issue that you're having. And the neat thing about CBD to me is it treats more than the symptom, it's going to the cause. So from that perspective, I think that is where everyone would benefit, because what it's going to do is help keep your system well. It's going to help enable your endocannabinoid system to respond to changes in the internal and external environment to help you stay as healthy as you can be. So from that perspective, I think this is the right supplement for everybody. So if you have a family history of issues, so issues like what? Heart disease, high blood pressure, stroke, heart attacks, any long-term chronic issues, inflammatory issues, arthritis, you can prevent all of that from you having to participate in that by taking CBD. It helps to prevent all of those and much more. So try it. So no matter what the issue, even if you don't have the issue, if it exists in your family and you don't want that to become your issue, you need to take CBD. So try CBD. CBD today will keep the doctor away. Have a great day. So when you look at so many of the diseases that CBD can help with, the medications that people are on are really interfering with their ability to live their life in a way that they would really like to live it. So they're groggy, they're spaced out, they have more pain than they need. It's like they're on this pill wheel and they're just taking more and more and more. And the thing that really makes sense when you look at it is CBD can help all of this, and the likelihood is it's going to help reduce the number of medications you're on. It's going to reduce the side effects. It's going to reduce the interference with your life. So your ability to live your life the way you want to live it is going to be much greater if you're using CBD and then taking a bunch of medications. So my recommendation is try the CBD, see what it can do for you, see what it does with the symptoms, and since it's treating the underlying condition, the likelihood is you're going to get better and better and your quality of life is going to greatly improve. And that's what it's all about. All right, so when you start looking at anxiety in the limbic system and how that works, and how that sometimes when that endocannabinoid system is out of balance, memories from the past linger and seem to be getting greater and greater. So like post-traumatic stress disorder, one of the things that CBD can help you do is release those memories. So as you're doing therapy, if you're doing the CBD with it, it's going to help you release those emotional memories that created the PTSD. And for a lot of kids with autism, they perseverate on these fears and anxiety, and that escalates the anxiety and makes it worse and worse. So for them, taking the CBD is going to help release those perseverations and those fears, and it's not going to generalize and create more and more triggers for the fear to expose and set them off. So not only is it good to help reduce the anxiety itself, it helps to eliminate and cut out this repetitive pattern that makes the anxiety escalate and become generalized instead of specific. So the CBD will help to address those issues and can be used in that way.
Let's talk about how well studied this actually is, and government has patent on study of it. It's proven to cure and heal. Mentioned this a little bit already, but maybe just do it in one.
Well, with the U.S. patent, what it's claiming on the patent is that it is a preventative and a treatment for oxidative stress illnesses. And in that patent, it lists 35, 40 illnesses that it is, and it doesn't limit it to that. It says that it can prevent these illnesses and treat these illnesses. So this patent is saying that this is a medicinal substance. It has power to prevent and treat disease, and that it is medically beneficial. So you really have to question the whole government stance on the whole issue, because why would the government issue a patent in 2003 on a substance that supposedly is not medically helpful. You really have to look at that. And to get that patent, they had to prove it through studies that had been done in other countries what the potential of CBD was. And I don't know the number of studies that they had to submit, but when you start to look at the studies that have been done, there's hundreds of thousands of studies that have been done on CBD and cannabidiol, on cannabis. So all of the stuff is well documented and researched and been done in clinical trials. There's trials going on presently on these particular pieces that we've been talking about. So we know that it's working. We know that these are options that are there. And there are already medications that have been patented. Marinol is one, and there's several others that are patented derivatives from this. So we know that this does have tremendous medical benefit. So when you look at the patent and it says prevent and treat as a supplement, you look at that list of diseases and it's like, it's amazing. If there is one thing that could prevent all of that, you would be nuts not to take it. Because all of those things are in all of our families. They run in families. So if you can take this supplement, the CBD, and prevent that from intruding into your life so it doesn't become your story, it's what happened in the past. To me, that's a tremendous reason to use this just as a supplement. Then if you do have a condition, you can use it as a treatment.
What does the government have to say about that? Who are we supposed to hold accountable for this? Can you talk to us about any of this?
Well, I don't know who you talk to about that, because when you look at the patent that's issued, it does have medical benefit. And the DEA and all of these other agencies, they're saying it has none, it's scheduled as no medicinal benefit at all. So how does that happen? And I think it happens from a disconnect, and there's an underlying reason to have this be illegal. So that sort of takes precedent, and then whatever it takes to cover that for a period of time, what happens is the government takes a stance, and it's going to be this way, and then what happens is things start to get squelched, and it's not released. And since this is a Schedule 1, you can't do any experimentation with it, so you can't really learn anything. And that's what's, I think, held a lot of the research back in this country. But it hasn't held other countries back. And so now it's really starting, people are asking more questions, and the internet has now made so much information available so easily that it's really hard to bury things anymore. I mean, they knew before they made marijuana illegal in '37 that it did work, and there was research that was done to show it prevents seizures. And they knew that. And it was introduced into this country in 1847 by Dr. O'Sullivan. And they used it for severe pain, seizures, and it was widespread and used, and we knew what it was, and we knew how to use it, and we knew what it could do. But all of that was then made illegal, and the book that was written, the research article from the seizure report, was buried. It was never published. So you can't get information if you can't get your hands on it. And I think what's happening today is the availability of the information through the internet, that you get information from all over the world. It's not just limited to here. And you as long as you have that access, you can now get information at your fingertips at an instant. So when I start looking to look up articles for particular applications, I can Google that and pull up 25, 30, 50, 100, 300, 400, 500 articles from research that's been done in other places that tells you what's going on. So it's so available today. I think that's what's going to help shift public awareness and make some real questions and people wanting answers. When you look at the Schedule I piece, that's really for marijuana. And the idea is that when you look at industrial hemp and marijuana, they are plants, they are the plant, but they are grown in different ways. When you're growing industrial hemp, it's planted close together, so it doesn't get branches and it gets very tall. So you get these long fibers that you can use. So the fibers have been used for centuries. They were used for sails, and that's why canvas is from the word cannabis, because they used the hemp to make the sails. It's been used for paper, it's been used for rope. So the industrial hemp has been around for centuries too, I'm sure. And it's how you grow it. So for the marijuana plant, what you're doing with that is planting it spaced large enough so it gets a lot of branches, and you let it go until it flowers. Well, with industrial hemp, you don't let that happen because that's not what you want. You don't want the flower. You want the main stalk. So it's the same plant, but it's grown in different ways and then processed in different ways so that you get the industrial hemp oil, which has the CBD in it, and you're not getting the flowers and the leaves, which are higher in the THC. And then it depends on the breed of the plant. And they're working now with high CBD, low THC plants. So there's big variance in what is sort of can be produced and grown. And finally, they're just starting to get in a couple of states where they're going to be allowed to grow industrial hemp again. And when you think about it, all of our states used to grow industrial hemp. All of our founding fathers were hemp farmers. So it's been here for centuries. It was a major crop for this country because we had ships, we needed rope, we needed sails, they were using it for paper. And then at some point, the applications got clouded. So it's like, well, we can do this, but then we're going to start stepping on toes when we do that. So then it depends who's in power, and then you start to waver on, yes, this is a good thing to do versus this is a bad thing. So if you have something that's walking that line, you can spin it to be as bad as you want it to be or as good as you want it to be. So I think, to me, when you look at the industrial hemp oil CBD, it has all the qualities of the plant without the high THC. And so you get those medicinal benefits. And that's why it is a supplement and it is legal, because it's from the hemp plant, the industrial hemp oil, not from the plant that has the marijuana. So as you look at, because the industrial hemp oil has to be imported, it has to go through processes to be cleared to show that it doesn't have what it doesn't have in it. And then it goes through the bureaucracy of being imported. Then it has to be processed and the cost of that process. So when you look at the cost of this versus the cost of medications, you're going to see that because of potential side effects with medications, adding medications, and typically you're never on just one medication. What happens is over time, the number of medications you're on escalates. You start treating side effects with another medication. So the idea is, with what this can bring to you for the price that it is, it's actually very cheap in comparison when you look at medications and what you're going to be paying for medications in the long run. And I think that's really a huge piece that you may say, well, this seems a little expensive. But you look at no side effects, you look at this is going to help cure the problem, and the problem's going to go away. I'm not going to have to stay on this medication versus looking at medications. When they start a medication now, they pretty much tell you you're going to be on this forever. Well, as that happens, you're on 1 or 2, and then you're on 4, and then you're on 8, then you're on 16, you're on 32. So that just keeps escalating, and the potential side effects keeps escalating. And the toll on your body, what it does to your liver, what it does to your kidneys, starts to build over time. Well, you don't have any of that with industrial hemp CBD. It actually is helping and supporting the function of your organs, not making them work harder and have the potential to destroy them. And that's a huge benefit and a huge difference. And what is the cost to the individual of getting fixed and being well and living the life you want to live versus being limited and on all these medications? What is it you prefer to do?
Are there negative side effects? Now you just answered that. Will it make me high?
So with the industrial hemp oil, because it doesn't have the THC, it does not have the euphoric effect of THC because it doesn't have that. So it's not going to make you high. That's why it's a really good choice when you're looking to work with kids, is you're not going to get that issue. So for, especially when you look at autistic kids, you can't explain to them what's going to happen. So if they're getting THC and they start to get these mind-altering experiences, it's very hard for them to figure this out. You know, it's like, what did you just give me? So the neat thing, and I think the thing that really adds huge benefit to the CBD, is it doesn't cause euphoria, you don't get high, and it's creating all the good things you want to have happen without the euphoric experience.
This strange thing again. Can you just talk to us about the weirdness between this patent and
All right,
the
so-
scheduling?
So you have a patent that says has medicinal quality and properties, that it can be used to prevent and treat these issues. And then on the other hand, the government's saying, no, this isn't, it's illegal, it has no medical benefit. And it's really a question of who's in charge and what are they trying to control, and how much control should the federal government have over the choices that the individuals make. I mean, for me, my family, I should be able to choose what are the things that I want to do. How do I empower myself to be healthy? How do I make those choices? And they're really my choices, and they're really up to me. It's not really up to anybody else. And when the federal government steps in and says, well, this is illegal, you can't do this, you really have to start to question, why are you even doing that in the first place? And I don't know why that happened. I don't have the details of what was going on at that time in history. But from what you can start to glean from people that you talk to, that there was a lot of conflict and control, and this was a way to decrease competition from those that were in charge. So when you look at it that way, it goes, okay, so this does sort of make sense. That if they see it this way and they're doing this and it's going to upset them and remove their control, then they're going to make whatever steps possible, even if it's make up stories, to cover it up and get rid of it, because it's going to displace them from their position.
You know, so it's a really serious issue.
Right.
And
Well, it is.
we're treating it that way.
Right. And it is a serious issue, because why would someone who knows something has great benefit to the public at large, to individuals, cover that up and bury that and get rid of it? And you have to look at what we're learning today and the applications that we're seeing, is it time that we really start to change how we deal with this? And is it time that we sort of say, all right, we know this can help. We know this is something that can benefit population at large, decrease the cost of healthcare. I mean, this is a huge issue. So maybe it is time we start to look hard at the stand that we've been taking, what we've been told, what we're starting to learn, and take this message from what we're learning and where we can go and change the things that happened in the past. It's the past, it's over. So let's take the information we have today, make a new decision, and let's move forward to help society at large and to allow the individual to do what they need to do. I think that's really where the issue is at this point.
Criminalization of cannabis has adversely affected us in any ways you want to talk about.
Well, I think criminalizing it really hasn't helped anybody. It's really created a burden. And it's taking away a substance that was put here to help us. So now we're going to have this war, and we're going to make this plant a bad plant, which really makes no sense at all. But it's the interpretation and the spin, and then how the people in charge really start to manipulate the information that's disseminated. And like I was saying earlier, when you say the word marijuana, this has a connotation of bad, it's illegal, it's this, it's that. But now the science is showing us it's something else, and that it does have benefit, and it does help individuals. And there are people who are living today who wouldn't be if they didn't have that available. So I think from that perspective, we really need to take a hard look at what we're doing and calling for a relook at this. Why is this Schedule 1 when we know it has benefit? Why can't this be changed to Schedule 2? Why can't we decriminalize it? Why are we pursuing this line? And even in states that it is legal in the states, there are issues all the time with the growers, with the places that sell it. I mean, there is this conflict going on because we really don't have clear policy that's trying to benefit the individual. It's trying to benefit those in charge, and the rules that have been laid down a long time ago that really are no longer applicable. And I think for that reason, we really need to rethink this whole piece. Well, when you look at the hemp oil CBD, it's a supplement, it's legal. There are no side effects, there are no euphoric issues. So with this being a supplement, it's really has to change the way that we're conducting ourselves. And I think there's so much programming and misinformation that's there. And to get these people to really understand, you're going to have to get the individuals to learn. Number one, this isn't marijuana. Number two, this is a supplement that is legal. And the movement toward trying to get cannabis legalized is progressing at that rate, but it's a whole different argument because this is legal, this works, and it's available. So I think from the perspective of how do we educate law enforcement about this, how do we educate social services about this, that we need to educate them as to the science of what's going on. How do we get this in a language that they can understand? And understand that this is something that's beneficial and has been shown to be beneficial through research. And that it's not something that's bad, it's not something that's criminal or illegal. This is something that is of benefit and has been shown to have benefit. So that's really going to be the big piece now, is how do we educate everyone on this, and physicians, people, the society in general, how do we educate them that this is something that is available, it is good, and it's helpful? So I think that's where the education piece is going to need to go. But it's going to have to hit across the board. And I think, this whole conundrum of has medicinal benefits, we've got a patent versus the government stance that it's illegal, it's bad. How do you walk that tightrope? And I think trying to get that explained is going to be where you have to go in walking that tightrope, to really explain to people, here's the science, here's what it can help with, here's what it can do. So why are we fighting this? It's not a problem, and it doesn't create the issues. So I think it's really going to be, this is years and years and years of brainwashing that's occurred. It's been pounded over and over and over, taught in schools. I mean, it's everywhere. So teaching that and redoing that is going to be a major deal, because we've got a lot of educating to do, and we've got a lot of work on our plate to try to get this so people really start to understand.
Hemp has been illegal for, we can't grow it in this country.
Right.
So it's all lumped into the same issue, I guess, so to speak, even though.
Well, it's the whole education and propaganda thing, that marijuana itself really has no benefit. And I think that's where the schism comes between, okay, you've got a patent on this that says it's medically beneficial, and your stance is, and the classification is, that it has no medical benefit. So I think we need to look at that and go, okay, what is the reality of this situation, and how do we remedy that? Because it is medically beneficial for a lot of people, and I think it has broad application. But as long as it's criminalized, this is a huge issue. And until I think everybody gets educated, and it's really an education piece, because the word itself, talk about cannabis, it just brings up these connotations because we've been indoctrinated since the 30s that this is really bad. So getting over that is going to be a huge hurdle. I mean, yes, there are segments of the population that sort of understand it and get it, but there is a huge segment, and I think the mainstream of the population doesn't even understand and doesn't even realize that there is an issue and that there is this conflict of information that's really been sort of buried. And by issuing a patent, the government is saying, yes, this does have medical benefit. So what's the deal?
You've got law enforcement who's been indoctrinated just like everyone else, but they're busting down doors, arresting people, ruining people's lives, breaking up families.
So you look at law enforcement, they're doing their job. So until that changes, and they've been re-educated, because they're gonna need to be re-educated as to what they're supposed to be doing. And that's gonna be a huge shift. Because this, they've been trained in this. They have dogs that sniff this out. I mean, it's a big deal. And this is a huge supplier of prisoners. So it's feeding that system. So when you start to decriminalize this, you're going to have to change everything from the top down. So it's going to be a whole re-education process for a lot of people. And I think some of the police officials are aware that this does have benefit, and in certain cases, but then you go beyond just the police force. You go into social services, and what have they been taught? And what are they doing, and how are they going to cope? I mean, this is a huge educational issue.
Do you think it's moral to put someone in jail or to arrest them, to beat their door down, to beat the crap out of them, put them in jail because they're criminals, do you think it's moral though to do this for cannabis?
So when you look at it's criminalized, so what does that mean? That means the police force has the right to break your door down, to drag you out, to lock you up, to put you away. And here we've been doing this for years and years and years. It's a huge population within our prison system that this is sort of how they came there. And now we're saying, well, this has benefit. So was this ever really legal? Was this ever really something that should have been allowed? And the answer is really no. It isn't, because this plant was put here to help us, not to hurt us. And I think the reality is we've got to now look at what it does, how it helps, and we've got to change it all. We got to start at the top. These kinds of changes, though, don't always start at the top. They start from the ground up. And that's really going to be the education piece, is educating the population. And more people are becoming educated. More and more people realize this does have benefit. And when your child is seizing and you can stop that and you save their life, you've got some serious questions to ask yourself and for other people to start to ask themselves. Because this had benefit. So if it has that, and we know that, and we knew that back in the 1800s, we knew that centuries ago, because it's been used for that for years and years and years. Why did we get to where we got? And how do we get out of this, and how do we start to change this? It's very important.
So what should law enforcement do?
Well, in looking at law enforcement, they're doing what they're told to do. And that's where you have to change it at the top, and you have to change how we look at this and what it's for, and what is really acceptable and what isn't acceptable. And I think this whole thing is way out of control and has been for years. But that's what the law is. So the law enforcement officers are there to enforce the law the way they're taught to enforce it. So they're doing what they feel is their job. What our job is now is to re-educate them to the benefits and get this changed so it isn't a criminal offense. That's what we have to get done.
Where does NIDA fit into this picture?
You look at, but see, that's really all of the drug enforcement, all of these agencies, they're all related to the feeling that the stand the government takes. I mean, that's where they take their directives from. They are part of the government. So until we change that, until we change how the government sees it and feels about it, all of these agencies are going to just keep going the way they're going, and they're not going to be flexible because it's still a Schedule I, and it's still not seen as any benefit. So it's a matter of them blindly doing what they're told to do.
What is the source of this mindlessness?
Well, I think the mindlessness has been propagated over time to where people are indoctrinated to believe everything they're told. And they're told this is the truth. This can't be helpful, this hurts, it's bad, it's criminal, it's all of these things. But now you start to have science showing you this is beneficial. It does help. It has applications that can be across the whole population. So it's really starting to wake up. And I think what happens to a lot of government employees is they're taken in to do this job, they're educated, so they're told this is what they're supposed to do the way they're supposed to do it. So they're not really wanting people who think for themselves. They're wanting people who will follow directions. And when you do think for yourself, you're not going to be long to be in there, because that's not what they're looking for. They're not looking for creative thinkers. They're not looking for people who are searching for answers other than what they've been told. And I think that's what sort of perpetuates all of this, that it's so locked into that a lot of people aren't asking questions. They're doing what they're told, and they're not asking questions. When you look at how Obama looks at this, that's his opinion. But until that becomes the opinion of the courts, the opinion of Congress, the opinion then, and it's decriminalized, that's when you're going to see the changes. Just because he believes that isn't enough to change the existing structure that's there. I mean, this is huge bureaucratic machine, and you have to change that. So just his opinion isn't going to change that. It's going to have to be legislation that changes it, a change in how law enforcement sees it, a change how the DEA sees it. I mean, every one of those agencies is going to have to be changed. So this isn't, we can all have this opinion, and we have the knowledge, and we're going, okay, the science shows this is helpful. But going from that leap to how do we change the laws is a big step.
So where are the minds? The minds are the higher-ups, the ones in charge. But we have the commander-in-chief.
But the commander-in-chief isn't the only one who's in charge. And then we have huge, wealthy establishments that want things to stay the way they are. Because this is sort of what got us here, and that will be the thing that we've got to overcome so we don't stay here.
So you're saying there's big money interests in keeping it illegal?
Well, if you have a natural substance that's very healing and can heal a lot of things, that would reduce what Big Pharma makes. Because now you have a natural plant that you can't patent, that's there for us to use and help us. They're not going to be for that. So you've now got that piece that's against it. Well, the resistance of traditional medicine is still against it because they don't really understand yet what the power that it can do. And the way they look at it is, you look at neurologists and their stand on seizures, this is the last resort. You have to have tried every medication that's available in multiple numbers. And if that doesn't work, then you could try this. But in my view, this should be the first step. It's the most natural step to try, rather than the medications. So we've got this whole medical system, this bureaucratic system, that's locked into the way they believe. So changing that, you and I can believe what we want to believe. Obama can believe what he wants to believe. But until you change how everything is processed and looked at, you're not going to change the policies, and that's really what you got to change. You got to change the law so it's decriminalized. You've got to allow individuals to make more choices. Who is benefiting from keeping this illegal? So Big Pharma is benefiting because if you have something you can grow and you can't patent it and everybody can grow it, and it's going to help you and prevent you from getting sick, you really just undercut the whole pharmacy industry. So now you've got the drug companies, you've got pharmacies, you've got all these, it's a trickle down. And who else is benefiting? So you have to ask yourself that question. We have this illegal, so now law enforcement has people to go after. So law enforcement gets bigger and bigger and bigger, and it just starts to spread and escalate. So if you take this and decriminalize it, now what is this whole population going to do? So you have to ask who doesn't want this to be legal and who does. And what is the reasoning? Why are they choosing what they're choosing? And I think these are the hard questions that you really have to answer. And then you're going to have to start to be able to say, this is what we as the people need, not you as the corporations need.